Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor. I am a psychiatrist and the head of the Center for Medical Information. Well, today I will answer your questions. And here's an interesting question that came in. Please tell me. Addiction specialists claim that alcoholism is an incurable disease. What do you think? You mentioned that there is a concept of a true disease, meaning a root cause that can be eliminated. But what about alcoholism? And it's hard to accept. And somehow the fact of an incurable disease with only remission and the need for complete lifelong abstinence from alcohol is not really accepted. Well, let's start with the fact that taking mind-altering substances, any substances that alter consciousness, because alcohol is one of those substances, if a person starts taking them, somehow consciously, yes. Somehow he understands that that's it. He's getting involved. First, you need to consider if there is some situation he is running away from. This is also discussed in psychiatry departments, and absolutely all addiction specialists know this, that with alcoholics, their problem isn't alcoholism. It's the people around them who have a problem with their alcoholism. They have some other problem. And what is this problem, EUM? We need to find out. A person's life is very different, and you can't even imagine. Some people even blame themselves for someone's death, while others know, for example, that they killed someone. It's not always uncovered by law enforcement, and so on. And again, situations can be different. Life can be all sorts of things. And maybe someone is trying to drown their conscience this way. Maybe someone left someone. And some kind of tragedy happened there. It could be some imaginary crime. It could be some imaginary guilt. It could be some real guilt. And if we're talking about this, yes, like a person drinks, but they don't think it's a problem of alcoholism for them at all. They have something else going on, something different, and that's actually their real problem. And addiction specialists know very well that telling someone, "You're an alcoholic, that's your problem," is completely useless until the person, until you actually talk to them, you won't believe it. But just talking, even just asking, what are you trying to drown out? So, is there something in your life that makes you feel like you need to punish yourself like this? So you need to realize that an alcoholic is punishing themselves for something. This is a person who has created this punishment for themselves. They feel bad, they really do. The body is being destroyed, falling apart. He knows his life is going down the drain. He knows it, but still, this is how he punishes himself. And sometimes, just having a heartfelt conversation with this person, just letting them speak their mind, can help. Even a subtitle editor might turn out to be the right tool that will help him simply not to drink. You and he need to break down this situation together. You don't even have to be a great professional, but just look at the situation from a different perspective and offer some other arguments. Consider them. So, of course, you need to do this wisely. You don't have to be a great professional for this. You just need to be a kind, intelligent person and just talk to the person. We talk about this until this splinters. Heartfelt, soulful, moral, whatever you want to call it, until this destructive situation is revealed. And somehow the person hasn't spoken out, so it's pointless to solve his alcoholism problems. I'll say it again, because his problem isn't alcoholism. You're solving, my friend. You're just solving a different problem. You see, that's all. It's like a pipe burst, but for some reason, you went to clear the path instead. That's what this is about. That's the difference. You fix the pipe, they clear the path. Exactly. Solving the wrong problem. That's the first thing. But if we're talking about alcohol as a substance, I've already talked about this in my videos. Let me digress a little bit now. Later on, I would like to ask you to write some topics for videos. But please, before you write what you want me to talk about in a video, check which videos already exist, because it's really boring to repeat the same things. Making yet another video about how to get off Santa packs. I already have 3 of them, because there's nothing new I can come up with about how to get off Santa packs, since it's all the same. And about this situation with alcohol. I've already talked about this in one of my videos, but I'll repeat it since I've decided to answer this question. Alcohol itself causes serious avitaminosis, primarily of nicotinic acid and vitamin B1. And in my video about alcoholism, I talked about it in detail. I even read out these symptoms. How can you tell that alcohol has already caused these vitamin deficiencies in a person? For example, there is this kind of bronze discoloration of the face. It's also called an alcoholic tan. It doesn't only happen to alcoholics. In general, people who have a deficiency of nicotinic acid can have it too. But this is what you see, for example, in chronic alcoholics, in people who are homeless. That's how it looks for them. A bronze face, swollen limbs, and the face has those very severe swellings. People who live on the street, they have these kinds of swollen faces. Limbs, arms, legs. All of this is a manifestation of severe pellagra and a deficiency of vitamin B1. Such a severe deficiency can be seen in what is called a rooster foot. This is a particular gait seen in alcoholics, where they sort of throw their legs out, like this, like this. They walk unsteadily. This is a sign of B1 deficiency. And in this case, it's just a tricky thing. The danger of OV emotional people stop sleeping. These are agonizing states. And naturally, they relieve this pain, this insomnia, with alcohol. And this is where the vicious cycle begins. This is where the vicious cycle begins. Therefore, the statement that this is an incurable disease, well, because the disease is not that a person drinks alcohol, the disease is something else. The disease is vitamin deficiency. Therefore, if we've dealt with the first part. In this situation, yes, as I said, it's like a moral splinter, something spiritual. A person has some kind of spiritual destruction, which they try to drown out, just so they don't have to look at this bright world. So, if we've figured this out, let's move on. It starts with the fact that a person can no longer give up this substance as a substance, which simply means that they already have it. They already have substances, vitamin deficiencies, and painful conditions developing inside them. And to solve this, you need to address these painful conditions first. In fact, there is nothing here that is different from the situation when a person can't get off neuroleptics. The substances are different, but the principle is the same. You see, neuroleptics are also toxic substances. This is also a toxic substance. These are also neurotropic substances, which acts on nerve tissue. It destroys nerve tissue, just like alcohol does. There's a multi-organ toxic effect, but we're focusing on nerve tissue right now, and they simply cause vitamin deficiencies. Therefore, a person can't get off these substances because they already have a real illness. These vitamin deficiencies caused by the toxic substance. Here, actually, the principle is exactly the same. A toxic substance is a toxic substance. That's basically it. There isn't really a big fundamental difference here. The substances are different, but the fact that they're toxic means they belong to the same class of substances. You see, it's not as if you ate a cutlet. That's all. That's why it doesn't work here. Because again, we're not solving the right problem. If we want to, that's kind of how it is. If a person drinks alcohol, I'll repeat myself, yes, to finish. If they drink alcohol because they have some kind of destructive emotional situation, then you need to talk to them and bring it out. However, you may later find that the toxic substance has actually caused an illness, such as vitamin deficiencies. But if we solve this problem here, then that's it. The person is free from this addiction, and there's nothing else here. It's a different story when already. When there is no longer a physical addiction, when it's appropriate, then a person might start using these substances again, like alcohol, because they don't know how to keep busy. Because this whole period, let's be honest, is a period of degradation. It's a period of degradation. And here, of course, self-discipline and a person's own strength of spirit play the main role. From this point on, they play the main role. Where will he spend his life from now on? Just wait for death in front of the television. Well, basically, that's not so bad. Or maybe go on, looking for some adventures, vivid experiences, using toxic substances. Well, or maybe he'll find some happier, brighter purpose in life, like getting an education, for example, or doing something else. So when we talk about the use of toxic substances, of course, there is a physical aspect here, but the moral component is very significant. A person's inner strength, the development of the mind, goals, intentions, pride, self-pride, and so on. That's it. Thank you very much for the question. I'll say it again. I have this feeling, that it's some kind of creative crisis. I don't always know what to write about. Thank you. Please leave your questions in the comments. I read them even if I don't approve. Thanks. The only thing is, if I've already recorded a video about it, please check the videos first. If you have a question, first see what videos are available. If, of course, I haven't covered the question yet, then of course it will be interesting to prepare a video about it, and it will be interesting to look at the books, to see and read them. And in general, sometimes there are really such moments. You need to sit down and really focus on the topic. I appreciate your questions, and thank you for your attention. If you need help, visit Durinskaya.com. We are always working, always in touch. Stay healthy.